Welcome to another episode of the FACE podcast. Today, I'm very honored to interview Dr. Robert Cohen, a board-certified plastic surgeon based in Beverly Hills, California. He's widely known for his innovative breast and body aesthetic surgical procedures and has a passion for natural-looking results. Dr. Cohen is best known for his signature procedures and has a real understanding of natural beauty. Dr. Cohen has been featured by numerous media outlets, is an international speaker, and has a passion for education in breast and body aesthetic surgery. I'm very pleased to welcome Dr. Robert Cohen. How has the perception of body beauty evolved over the years, especially with the rise in social media?
So I think, in the past, people were maybe focused on like more extreme types of surgeries, like more overly done surgeries, and maybe got this impression that that was the way to go. And then over time, I think as surgeries have gotten more nuanced and surgeons have improved in their techniques, the drive has been, at least amongst the top surgeons, towards more natural looking results. And that's really important because really analyzing a patient, understanding their anatomy, making something look that it fits them, not trying to make them look like somebody else or like a picture, is really important. And with social media, it's a little bit of a double-edged sword because on the one hand, you do see some of this more extreme stuff coming up on social media, and it extreme drives towards more extreme. And people lose sight sometimes of like where things are going. Like a good example would be lip filler, and somebody gets a little lip filler and it looks really nice. And then they get used to that look and they put in a little bit more. Now they're looking a little bit overfilled, but not too bad. And it just keeps going and going and going. So that trend in social media, I think, is very dangerous. On the other hand, what we are seeing in social media, there's so many surgeons posting their work that some people will start to see like, wow, this is really high quality results. It doesn't look like this person had surgery. They just look like a much better version of themselves. And that's where surgery should be driving towards. And so by showing examples of really high quality surgery, I think patients get a sense of, okay, this is maybe where we should go, not something that looks unnatural, fake, or operated on. The thought in the past was like, oh, if you get a surgery, you should be able to tell that person had surgery. That's not the case. It's really the opposite. You don't want people to know that you had surgery. You want to look like the best version of yourself, basically.
I really have found recently content creators, influencers, even celebrities have been much more transparent about their journey with plastic surgery and having procedures, and they're quite happy to post that they've had a facelift or a tummy tuck post-children.
Yeah.
Has that changed your practice much? Like with people or the consumer have a lot more information these days?
Yeah, I think it's a great trend. I think if you look at, let's say, the United States 20 years ago, when I kind of started my practice, there was a lot of like stigma about plastic surgery. People were trying to hide it. They didn't want people to know about it, et cetera. And we always looked at Brazil, and they were like 20 years ahead of us, where people would be out on the beach with their bandages on because they were proud they were able to do something nice for themselves to make themselves feel better. And so that is kind of shifted also in the United States, where people are much more open about it because there's nothing shameful about plastic surgery if you're doing it to, correct a problem or something that's bothered you. I think as long as something's done within reason and done naturally, it's not a bad thing for patients to do. So as more and more people are open about it, there's less stigma, there's more information, and people can start seeing the range of what's possible. And it gives them more information to make good choices for themselves, I think.
You're a world-leading expert in breast and body aesthetic surgery. I think one of my most asked questions, because I have a demographic of mums that follow and listen along.
Yeah, that's my wheelhouse.
Let's talk about post-children, breast reduction,
sure,
and abdominal surgery.
Yeah. So with pregnancy is probably one of the main drivers of patients coming to see me in practice because it creates a lot of damage to the tissues sometimes. And obviously the patients are very happy to have their kids, but they may not feel confident in their breast. For example, the breast sometimes can get droopy or a lot of stretch marks, or, things can change in a way that they're just not comfortable anymore. The abdomen obviously can also get stretched out. And these aren't always just aesthetic issues. They can be functional issues as well. Breast reduction, not always from a pregnancy, but patients with very large breasts can have a lot of back, neck, and shoulder discomfort. Patients who have bad diastasis, which is a split in the muscles that can occur after a pregnancy or multiple.
Can you explain what diastasis is?
Absolutely. So when somebody has a pregnancy, obviously the abdomen, the abdominal wall expands slowly over time, but it gets, quite big. And everybody's going to react differently depending on their genetics and how elastic their tissues are. But for many patients, the connective tissue holding the abdominal muscles in place, which is called the fascia, will get permanently stretched. And what that does is it creates looseness in the abdominal wall and a malposition or misplacement of where the muscles go. And so that not only can create sort of a bulgy, loose looking abdomen, but it can create weakness in the core, which then can translate to back pain or discomfort or inability to maybe do a sit up properly. So for patients who have had those kind of issues, sometimes it's a twofold concern that they have. One is that they're not happy with how they look. I've had patients who literally maybe look like they have an 8-month pregnant abdomen.
Wow.
And I had one patient I remember who came in to see me for surgery, and she said every day she was crying because somebody would ask her when she was due. And it was really upsetting for her. And in addition to the not being happy with the appearance, she was having a lot of back discomfort because her muscles were no longer in the right place. So with surgery, I was able to not only correct the muscle layer and put the muscles back in position and tighten the core, but I was able to take care of all the loose skin. So she went for somebody who wore very loose shirts and was extremely self-conscious, wouldn't go to the beach, for sure wouldn't wear a 2-piece bathing suit, and honestly wouldn't even let her husband see her in the bedroom with the lights on.
Wow.
And after the surgery, it was a transformation. Her confidence level is up. She felt so much better about herself, what kind of clothes she could wear, and she felt much more physically comfortable. So, it's sad that maybe physical appearance has that much of an impact on how we treat other people or how we see ourselves. But the reality is it does have an impact. And when somebody's not feeling confident about themselves, it can affect many aspects of their lives. So I don't think plastic surgery is certainly the cure for anybody's major problems or whatever, but I've seen people have a tremendous improvement in their quality of life after the surgery, where they go from maybe just really low confidence to feeling really great about themselves. And that will lead towards healthy lifestyle changes like exercising more and eating better. And it just one thing leads into another, and it takes them down a really good path. So we're not necessarily saving lives in plastic surgery, but I always think we're really improving lives. And that's really important, I think, for people.
I feel like there's a lot of misconception around, breast and body aesthetic surgery as it's like a lunchtime procedure or walk in, walk out. It certainly is not.
Yeah.
So from, the day you're booked into theatre, you're meeting your anaesthetist, you're about to go into the operating room.
Yep.
What does that look like? How many days without exercise or weeks before you go back to work as such?
Like you said, this isn't a spa treatment. Surgery is real. There are risks to it. And so it's extremely important that safety is the number one priority of any surgeon you're going to. Obviously, high quality results is like a close number 2 after safety. So the recovery and the risks and what's going on will vary widely depending on what kind of surgery you're talking about. So if you're talking about a smaller surgery, maybe just skin level or something, that might be a very quick recovery where you can go back to work in a few days. If you're doing something like a mommy makeover where you're having, let's say, significant breast surgery combined with abdominoplasty, meaning a tummy tuck surgery and some liposuction, that can be a pretty significant recovery. And some of those patients might have a little, significant amount of pain for the first week or two, might need to take a couple weeks off work, maybe take a month and a half off any serious exercise. So there's a commitment to that. The upside is that the pain and the recovery all goes away, and then the results will last for a long time. So it's generally very worthwhile, but patients need to understand what they're getting into. It's not like a spur of the moment kind of decision. You really need to do your research going to surgery, understand what you're getting into, understand the risks, and have, really a good connection with your surgeon to make sure that you're going to proceed as smoothly as possible.
So in talking about surgeons and finding a particular plastic surgeon for the procedure you're looking at, would you recommend patients see more than one surgeon?
I mean, I guess that kind of depends. In general, I don't think it's a bad idea at all. When somebody's thinking about plastic surgery, I think the process first is make sure the surgeon is a board certified plastic surgeon. That's your very lowest bar that you need to cross. Then you need to see what kind of experience does the surgeon have and what kind of procedures are they particularly good at. Then you need to see maybe look at their CV or their resume, see what their training is and what their involvement is. Look at a lot of photos because somebody can have a great reputation, but when you actually start seeing their photos, you may not like their work at all, and that's an indication that you shouldn't go to that surgeon. Once you've kind of done that baseline research, and obviously you can check and see if they have any malpractice cases or any problems with the medical board, then the next step is to go and meet them personally. And when you meet the surgeon, it's a relationship. So just like anything else, if it doesn't feel like a good fit for you, you should probably listen to that. If the surgeon, you and the surgeon click and they seem like they're really focused on quality and safety and then they've met all the other checkpoints, that's maybe somebody you might want to go with. And obviously, if you have friends or somebody else who's seen that surgeon and had surgery and you like their results, that's a great reason as well. For me, sometimes I'll have patients who, quite frequently, I have patients who come in to see me for surgery without seeing other surgeons because they know people I've done surgery on, they've seen my work, they know my reputation, and they feel very comfortable after we meet and talk that I'm the right one to do their surgery. But I would never begrudge a patient who wants to see multiple surgeons because I think that's part of the process. And if they see multiple surgeons, they ultimately choose you, that's great. That's even a better reason for them to be confident in you as their surgeon.
I think it's really important for informed consent because it's not a quick decision.
Absolutely.
And you need to take your time and really understand the process.
Mm-hmm.
And it might come down to a personality thing.
That can be a part of it.
Another thing I wanted to touch on was breast implants.
Yep.
One of the most common things I get asked is, if you get a breast augmentation, when is a replacement necessary?
That's a tricky question. I mean, most patients have the idea that every 10 years you have to switch implants out. That's kind of become like a sort of in the vernacular. In reality, the new high quality implants that are coming out now should last for well over 10 years in general. But the implant rupturing or breaking is not always the reason why you would need a reoperation. Okay. I usually tell patients the weak link in the chain is usually not the implant, it's usually the patient's tissues. Because many patients are not just coming in for, at least people I see, they're not just coming in for a breast augmentation, like they have small breasts with tight skin, they just need more volume. A lot of these patients may have lost volume during a pregnancy, had damage to the skin or weakening in the skin. And when you add volume, that's adding weight to the tissues. In many cases, I'm going to put in a reabsorbable reinforcement mesh to help stabilize the pocket, but things can still stretch or change over time. So patients need to know that when you do implants, it's not a one-time deal in general. It's going to be multiple surgeries over time. How long a period of time depends on the anatomy, depends on what the issues are, depends on how elastic the tissues are. Also, it depends on how big of a size you go with, because the bigger the implant, the more stretch and weight is applied to the skin. So all of this means that you need to go into a surgeon that really understands what they're doing, who can explain all these issues to you and make sure that the implant's something that's right for you. I get a lot of patients coming in for interest in breast augmentation, and when I see them, they may do better with just a breast lift or a breast lift with fat grafting or something. Or the strangest thing to me is when I get patients who are coming in for breast reduction surgery where they have too much natural tissue and back and neck issues, and they're seeing other surgeons who are recommending putting an implant in, which I think is kind of crazy because they already have too much of the natural stuff. Why would you then add a foreign body? I do a lot of augmentation with implants over the last 20 years, but I'm not a surgeon who pushes implants. I make sure that the patient really needs an implant before I put an implant in, because implants do increase the maintenance. And I want, in general, for patients to have the easiest postoperative lifestyle possible. So sometimes the implant is necessary to get them what they need. A lot of times you can get away with other techniques to try to avoid a foreign body when possible.
Talking about the fat grafting, there is also a lot of talk about your body just reabsorbs the fat. Yeah. Can we talk about what you retain and where you get the fat from, and where is the best place to get the fat from? Yeah, so fat grafting I think is a great technique. It's kind of become more of a hot topic over the last 5-10 years. When I talk to patients about fat grafting, I always say there's major pros and major cons. So the big pros of fat grafting, it's all natural tissue, which is nice. You don't have to replace it. You don't have to worry about foreign body issues, things of that nature. You also get a bonus of where you take the fat from. Usually people are happier with how that looks. I'd say the flank or love handle area is probably the best area for fat harvest, but it really depends on the patient's anatomy. Areas are probably most common to be flanks, maybe outer thighs, inner thighs, abdomen. But again, it depends on the person. The downside of fat grafting is the predictability is not the same as with an implant. So if you take an implant and it's 300 cc's and you put that implant in a person, they are now 300 cc's bigger, guaranteed. When you're talking about fat grafting, you don't know exactly how much fat's going to come out with the liposuction. Then you have to process and purify the fat. So then you're going to have less of what came out that's good enough to put back in. And then of the fat that you end up re-injecting, not all of it will stay permanently. And that will vary patient to patient. So, I generally quote patients about maybe 60% will stay permanently. I think that may be a conservative number, but I'd rather have them underestimate. I have some patients where it seems like maybe more like 80%. Sometimes disappointingly, it'll be less. So people who are doing the fat grafting route have to understand that the fat is designed to help enhance the breast, but you're not going to get the same predictability, but you do get those benefits of
all natural, not worrying about like the maintenance. And that's a big deal. So I think the patients that are the best candidates for fat grafting are patients who have already a decent amount of volume, like maybe a full B or a C cup or bigger, and just have a loss of volume in the upper breast. And then you can use the fat grafting to enhance that area without adding an implant. If you have somebody who's truly like just a flat chested A cup, especially if they have tight skin, that technique may not be very effective. And those are patients probably who are better served by breast augmentation with an implant.
I've seen a lot of influencers in the last 12 months sharing their journey about removing their implants. Has that been something that you've seen in your practice here in Beverly Hills?
Absolutely. I do a tremendous amount of explants. I do a lot of augmentation, and some people do great and love their implants. So implants are not a bad thing, but they're not necessarily for everybody. Then there's patients who want their implants out for various reasons. A lot of times maybe they've just kind of done with it. They don't want it the size anymore. They want to be smaller. They've maybe had complications or issues with their implants, and they just don't want to keep going through operations. There's that subset of patients who have breast implant illness, who don't feel well because of the foreign body. So those are all reasonable reasons to take implants out. Removing implants is not a simple thing because now the tissues have been stretched and damaged. And so there's a process to how you do that. Sure. A lot of surgeons don't really understand the best way to handle patients who want an explant. And a lot of times it's very important to remove the implant first so that the tissues can shrink and contract. Kind of like after you have a baby, the stomach will do that, but the breast do it at a much faster rate. So generally when somebody wants their implants removed, I'll take the implants out under a local anesthesia, just through a small incision of the breast. It's very easy to remove a silicone implant, or with saline, it's even easier. You just poke an IV into the implant and drain the saline, and you let the breast shrink for about a month or so, 6 weeks maybe, and then you can go back and do a much more accurate reconstruction where the patient can see what they look like, make sure they're okay with that smaller size, and if not, you can always put an implant back in.
Sure.
And it gives me much better quality tissues to work with, so it's kind of a win-win there. If you're not doing it at stage, you're probably not getting the best results possible with those kind of surgeries.
In terms of a surgery where the original implant was put in front of the muscle and it was going to be removed and then put behind the muscle, what's that process look like? Does there need to be an explant for a certain amount of time?
Not necessarily in those cases. So if you're replacing an implant with another implant, especially if it's sort of a similar size or larger, for example, then you can do a one-stage procedure where you take the implant out from over the muscle, lift the muscle, and put it under the muscle. But in those cases, it's extremely important to then bridge or reinforce that gap under the muscle with some kind of reinforcement material, generally a resorbable mesh, because otherwise the implant can shift out of position or drop too low, or you can get a strange shape. And in most of those cases, you're also going to need to do a breast lift at the same time. So removing the implant from over the muscle, switching to under the muscle, reinforcing the pocket, and then doing a breast lift to make the breast look really nice. And there's always ancillary procedures like liposuction in the axillary or bra fat area. Maybe if the areolas are too large, you can make them smaller. Long nipples you can reduce. Inverted nipples you can correct. So the attention to these little details is the difference between having a good surgery and a great surgery in many cases, because, it's the breast as a whole. You need to understand all the aesthetics to make sure it looks really nice on the patient, fits them, and the anatomy all blends well together.
I meet so many mothers because I have children. I'm always at the school.
Yeah.
And they know about my podcast and that I work in aesthetics. And one of the number one questions I get is about their daughters that are wanting a breast reduction. Got it. So can we talk about that? Because I know that's a passion of yours.
Yeah, breast reduction is probably my single favorite surgery to do. And the reason for that is it's both a really dramatic aesthetic improvement for patients, but it's also a tremendous physical improvement for patients. So that's one of the few surgeries I'll do in patients under 18, because those patients are having back and neck problems, and it can be severe. And so with a breast reduction, you are reducing the size of the breast, lifting the breast, changing the shape of the breast. Many of those patients will have significant asymmetry, so you're evening things out. And then honestly, with some of those younger women, they're getting unwanted attention too from large breasts, and it's very distressing for them. They just want to be a normal kid and like be out in a t-shirt or wear a two-piece, and they can't even buy one bathing suit. They have to buy a bottom from one thing and a top from another thing so they fit. It's distressing.
And also for their formal wear, because that's the age they're going to their formals or their dances, and they want to wear that dress with the backless dress and they can't. So that's the very reason I get asked this question. Yeah.
So those patients are some of my happiest patients. They usually, obviously, if they're under 18, they're coming in with their parents, and even over 18, and if they're on the younger side, usually the parents are involved as well. This is a surgery I'll do on patients. Like I've done breast reductions on patients in their 70s. Almost everybody somebody who's doing like a later breast reduction will say, why didn't I do this like 20 years ago or 30 years ago or whatever number of years ago? Because after the surgery, they just feel so much better. It's a really dramatic procedure that almost always makes people happy.
In terms of menopause, can the breast tissue grow during menopause?
So menopause, pregnancy, hormonal changes, that can affect the breasts in different ways for different people. So some patients will get what's called involution, where the breast will shrink and get droopier. Other people, the breast will grow. That can also cause them to droop as well. So yeah, there's a lot of things that can kind of change or weight gain, weight loss. All those things can change the breast size. And so sometimes maybe patients were totally happy with their breasts at a certain age, and then all of a sudden, they're not anymore. And surgery is usually the only way you can truly correct that kind of a problem.
Mm-hmm. So you're at the top of your field. You're an expert in breast and body aesthetic surgery. How does someone like you get better?
So I think if you're a good surgeon, you're constantly wanting to improve. So I would say I thought I was really good coming out of the gate, my early years. But if I look back on what I was doing then and what I'm doing, 20 years later, obviously it's a quantum leap from where I started. So what you're doing as a surgeon, if you're sort of focused and really interested in getting the best results, is constantly analyzing what you're doing and trying to improve. One thing that really helped me a lot was early on in my practice, I started teaching at conferences, writing papers and book chapters, and I've continued to do that throughout the years. And when you're doing things like that, it really focuses your attention on what are you doing and why. You can't get up in front of a conference of hundreds of surgeons and start telling them, oh, I do this just because. You have to have reasons for everything you do. And so that forces you to make sure that anything you do in the operating room has a benefit and there's a reason behind it. And the other thing is experience. When you're, for whatever reason, fairly early in my practice, I started doing a lot of revision work. And what that means is I was getting patients that had poor surgery by other surgeons or major complications, and I had to start fixing problems. And those were always some of the hardest cases. And when you do harder cases, it's like a whetstone. It sharpens your skill set. And the more problems you see, you start at first kind of focusing on, well, what's the problem and how do I fix it? And as you get better and better at fixing the problems, you start to say, well, what caused this problem in the first place? And how can I avoid getting into trouble in that same way? And then you become more focused on how to avoid problems and do the surgeries in a way that won't lead to these complications. One thing I would say is that the best surgeon in the world, in the best circumstances, can still get a complication. So if you're going to have a surgery, it doesn't mean that there's nothing that could go wrong, even in the best hands. So patients need to understand that, like, having a surgery, it's like getting your car and driving somewhere. Most likely you're going to do fine. There's always a chance you can get in an accident. With surgery, we're dealing with humans, human tissue, biology, things can happen. So the key there is you want a surgeon that, number one, is going to put safety first and understand how to minimize your risk of complications. Number two, somebody who understands how to fix the complications if they occur. And really, number three is somebody who's really going to take you in and take care of you if you have a problem. I always tell patients, the way you really determine who a good surgeon is not who they are when surgery turns out perfectly. It's when the surgery doesn't turn out perfectly and when you have a problem. Because there are the surgeons who then you call the office and they don't want to deal with you, or the surgeons who then bring you in closer and really take everything super seriously as far as how am I going to take care of this person in the same way you take care of yourself or a family member if they're having that kind of problem. For me and for people in sort of my level who I'm colleagues with, we take our complications extremely personally and seriously. And we understand they happen and it's not going to be the end of the world because we know this is part of surgery, but we take it very seriously. And if somebody has a problem, I am literally doing everything possible in my power to make sure that they not only are doing okay during the complication, but that ultimately they're going to end up with an excellent result. And so that's what it takes, I think, to be a really great surgeon, is not just take on the easy cases and dealing with things when everything goes smoothly. I think you need to be able to take on the most complicated cases and also be able to handle things when things don't go exactly how you're hoping or expecting them to.
I feel that really comes back to rapport and building relationships with your patients. And I have read that you are very focused on, patient care and, really making sure that the patient has that really high level experience within your practice at Beverly Hills.
Absolutely.
So can you talk about how that came about, your mentors, or where you learned that was such an important part of your practice?
Yeah, I mean, I think a lot of it's just my nature. I kind of get very involved. I've become so focused on plastic surgery over the years, just between my training and my practice. It's become sort of a true passion, and also, I'm a kind of a people person, and I care deeply about the well being of my patients. I take it, like I said, very personally if something's not going exactly the way I want. I want to do everything in my power to help. I really like my patients. I think I have a a great relationship with my patients. And I tend to, I guess you attract what you put out. So I try to be a very, natural, conservative in terms of safety issues, involved surgeon that
Mm.
really likes to talk to people, find out what they need and want, and also advise them what they realistically can and can't expect. And I tend to get a lot of patients who are very educated, who have
Sure.
done a lot of research, who kind of know what they want, but are also sort of reasonable. I don't get these people coming in with crazy pictures saying, I want to look like this. I get patients who already by having watched me on videos and podcasts and been to my website and been to my Instagram feed, they kind of understand what my personality is about. And
Mhm.
if they don't really match that, I'm assuming they probably go somewhere else. So the people I'm getting in are people I really enjoy working with. It's a two-way street. So the patient needs to feel comfortable with the surgeon. Surgeon needs to be feeling comfortable with the patient, and you have to feel like your goals are in alignment. And once that happens, then it's a surgical relationship, and you can proceed to the operating room. And if you're a patient and you're feeling kind of like a red flag, you're feeling sort of like I'm not sure about this, don't go to that surgeon. Listen to your gut. And I do the same thing. If I very rarely, but if I get a patient who I really don't think is a good match for me,
Mhm.
I won't operate on them because I don't want to get in a situation where we can't, God forbid there's a problem or just a disagreement in terms of aesthetics. I don't want to get in a situation where I don't feel comfortable communicating with that patient.
Getting back to that, patients bringing in photographs. We're living in a world now where everyone filters their photos,
Hmm.
and everyone's looking at AI.
Yeah.
And has it been something that's coming through in your practice? I know in my non-surgical practice that people often bring in photos of celebrities,
Yeah.
or they'll often bring in a photo of themselves,
Hmm.
but it's
Like
been
adjusted
filtered,
with, yeah.
yeah, to what they want themselves to look like.
Right.
So how does that affect your practice?
I mean, thankfully for me, I very rarely have these kind of issues. As I said before, I think I kind of, just by nature of who I am and what I've put out in the world, I think I sort of pre-screen patients who they realize that's not my thing. But I do think it's just a big problem in general. I think the fact that people are seeing themselves in these filters, I think a lot of it started during COVID, where people
Mm,
are spending a lot of time
mm,
just with nothing to do and looking at themselves, and they start doing these filters and creating sort of idealized versions of themselves, and then they start to see that as what they want to be. It's very destructive, I think, in many
mm,
ways to what it is to be a person, because human beings have flaws, we have asymmetries, we have imperfections. That's not a bad thing. That's what makes us, people and unique and individuals. You don't want sort of a homogeneous, everybody looks like the same fembot kind of thing. Now, obviously, we're trying to make everybody sort of the best version of themselves, but there's a limit. And if you try to exceed that limit, I tell patients, if you're shooting for perfection, you're just never going to be happy, because there's
mm,
no such thing as perfect. We're just trying to shoot for the best that we can get for who we are. And then once we get there, just try to be happy with that, and focus on other parts of your life that don't have to do with maybe appearance. So it's really sad when I see like the AI and the filters
mm.
becoming almost obsessive. I think the people that are going to be the most susceptible to it are the kids and the younger
Yes.
people, where they're really growing up in this era.
Mhm.
I really hope that that does not become sort of a trend. And I think it's really on plastic surgeons, providers,
Mm.
anybody in the beauty industry. We need to keep kind of course correcting on this and making sure that people don't get off the rails with this. Otherwise, we're going to have just a world of unhappy people who want something that they just can't achieve.
I keep before and after all the image on Instagram and the Getty image
Uh-huh.
side by side on an
Mhm.
iPad to show patients the skin quality difference,
Yeah.
the open pores,
Yep.
the texture, the irregularities. And when they're faced with that, they're like, oh,
Mhm.
it is so obvious
Yep.
that these photos are all manipulated.
Yeah.
And that's what we're aiming and striving towards.
Yeah. And it's,
And I find, sorry
oh,
to
my
interrupt you,
bad.
I find that, we're in a time where 9-year-olds are wanting to use retinol and
Yeah.
are buying, a 10-step skincare routine.
Mhm.
How are you faced with the younger patient? Are you finding that teenagers are wanting plastic surgery procedures for breast or body?
I'm not seeing a whole lot of that. Again, my patient population tends to skew a little bit more older, like probably like late 20s through early 50s is probably the main part of my bell curve. I do see some younger patients. I do hear of these problems of patients, like not patients, of kids that are like in their like early teens or younger going and using skincare products that actually make their skin worse.
Yes.
I think that this is maybe driven by advertisements and things of
Sure.
that nature, maybe some misconceptions about how the skin works. You hear that all the time with various things like, oh, you need to get a colonic because you need to, wash out the toxins. Well, our bodies are designed to do all this stuff naturally. You don't need all these extra procedures sometimes to do that. So, but it is more of a problem. And I really think, again, that it's on the providers to sort of say, don't do this. It's going to actually make you worse. And then hopefully the message will get out there. I do think it's going to be a problem that we're battling more and more, maybe as the filters become more prevalent,
We're positively seeing a huge swing to more natural looking results.
Absolutely.
Finally,
Thankfully.
after the rise of the BBL and,
Yeah.
larger implants.
Yeah.
Talk about that. Talk about natural looking results.
I'm so thankful that the era of the overdone BBL, the giant round implants, the overstuffed lips, the overdone cheeks, it is not only is it damaging to the patient's tissues, I think it's distressing to see patients look like that. Some of these, it's just beyond anything that could occur in nature. And the fact that people are actively seeking for it was bad enough. The fact that there are actually surgeons doing this to patients in exchange for money is just, it's shameful. There is a point where you tell a patient, this is not appropriate for you. And you have to stay firm with that. And I tell patients sometimes, it's not very often, but I'll get some patients who are really seeking maybe something that I don't think is right. And I'll tell them, I guarantee you shop around enough, you will find somebody that will do the surgery for you. And it's going to be a bad idea. You're going to create permanent damage. You're going to regret it. And it may not be completely reversible. So I am so thankful that at least in general, it seems like the trend is going back towards natural, something that fits the proportions, something that's based on anatomy. There's still a lot of outliers and still a lot of bad surgery being done, but at least the trend is back towards going natural. That's always been part of my aesthetic and something very important to me. And I've talked about it when I talk about different surgical things at meetings and stuff. And I'm really glad to see that that is becoming more the goal of patients, thankfully.
Boys have breast tissue too, and men, and it's not something I've actually talked about on my podcast before, but something you are passionate about also, which is gynecomastia.
Absolutely.
Can you talk us through that for our listeners?
Yeah. So we're talking about the shame of plastic surgery and most people are feeling comfortable with it. That's one of the last bastions of people who are very, very ashamed of what's going on. Unfortunately for men, anything that makes them feminized, if they're sort of like a masculine male, they're going to get teased a lot by their, friends or colleagues. And it's not just kids that are doing this. I see adults who are taking a lot of, teasing from other people. It's devastating. And you can't imagine the kind of psychological impact that it has on some men, to the point where they will not take their shirt off and they won't even go to the beach, or they won't get in the swimming pool, or they won't do activities because they're so self-conscious. It's one of those areas that's really bothersome. Now, gynecomastia, for people who don't understand, is generally two different tissue types in the male chest. One is fat, usually diet-resistant fat, which is the last area to shrink when they lose weight. And the other is glandular tissue, which is this rubbery, dense breast tissue. It very commonly develops during puberty in men and most often goes away, but sometimes doesn't. And there can be a genetic component to this as well. So thankfully, the surgical correction for this is relatively straightforward. I generally do just a small incision just at the bottom of the areola, very, very narrow. And through that, I'll do liposuction to remove the fat, and I'll do direct glandular tissue resection to remove the excess glandular tissue. And that usually will flatten and masculinize the chest. And then, often the areolas might be a little large, and those usually will get smaller as the tissue is removed. When I tell you some of the most impacted patients I've seen from surgery are some of my gynecomastia surgery patients. I remember I had one patient who was, as an adult, he was in his 30s. He had essentially B-cup female looking breasts to the point where when I posted before and after on Instagram, I got flagged because they thought I was posting a nude female chest. And he literally had never gone shirtless, never gone to the pool, never gone to the beach. And we kind of joked because after the surgery, we said he kind of got an allergy to shirts. He was going shirtless everywhere because he was just so excited to kind of live freely and not worry about his chest again. So when I tell you gynecomastia is one of the most powerful procedures that we do in terms of confidence building, that's it. Because men don't tend to get a lot, or definitely not as many surgeries as women do, but usually it's liposuction. But gynecomastia is probably the biggest one that I do and probably the most impactful.
Mm-hmm. There's a really, really fine line between enhancing a patient's body and keeping their individuality. Is this something you've come across in your practice?
I always say plastic surgery shouldn't be a cookie cutter kind of procedure. Every person is a unique individual with ideas of what looks good to them. They have unique anatomy and tissues, and they have to be analyzed as a unique person. Mm-hmm. So if you're applying the exact same techniques over and over again, it's like they say, if all you have is a hammer, everything looks like a nail. The surgery should be appropriate for the patient. So sure, there's some general ideas of what people all kind of like, but there's variations there, and everybody's body's a little bit different. Mm-hmm. So I think really when you go into surgery, you should be kind of open-minded about not looking exactly like somebody else, but looking like the best version of yourself. You can use other people's appearances as maybe inspiration for which direction you're driving towards. Like some people like a fuller breast, some people like a smaller breast. Almost everybody likes a perkier breast, for example. But you don't necessarily want to be exactly like somebody else. And I do think that with certain things, like a lot of facial stuff, we've seen like everybody almost morphing into like the same kind of look with overfilled, cheeks and lips. And everybody just looks like a clone of everybody else. One of the things that makes humans interesting is that everybody's a little bit different. So I would say it's a balance. Kind of rejoice in your uniqueness and your individuality. Make some adjustments if you feel less confident and you think that would make you feel better about yourself, but don't overdo it. And it's all about balance. Everything is about balance, moderation in life. I think that's the best way to live. And if you push too extreme, I think you get into trouble and maybe may not be as happy later.
You have such a passion for education. When are we seeing you back in Australia?
Oh, back in Australia, yeah. I was there before COVID. I had a great time over there doing some instruction on fat grafting. I would love to get back there, hopefully sometime soon. Sydney is probably one of my favorite cities in the world. Melbourne was beautiful.
It's a great place.
So yeah, and the people there are amazing. So I don't know when I'm going to be back. I have some really good friends. I know you're going to be speaking with Michael Moroshnik, who's another amazing breast surgeon.
In the next few weeks.
We really appreciate each other's work, and I love what he does. So I hope to get out there. And I keep talking about coming out to visit him at some point. So I don't know when, but hopefully sometime soon.
And what's next on the horizon for you?
Just continuing to do what I do, keep improving my techniques, trying to take care of as many patients as possible. In a couple of days, I'm going to be flying to Scottsdale, Arizona, where my other practice is, to be speaking at a Experience Insights meeting on. I'm going to be talking about breast reduction surgery and sort of ways to avoid complications and get best results. So I continually want to just stay at the top of my game and help give back to the specialty as much as possible, because we learn from the people before us and we try to pass that knowledge down, but with even more improvements to the people following after us. And it's nice to see like the up and coming plastic surgeons taking an interest in getting really high quality, safe and natural results. And we have to kind of set the stage so that they have something to look forward to, maybe emulating and improving upon.
So what's the difference between a good plastic surgeon and a great plastic surgeon?
So I think there's a few things that really determine what's the difference between those two things. So to be a truly great plastic surgeon, I think you need a few things. Number one, extreme attention to detail. It's not just about getting an okay result. It's all the little things beyond just the main surgery that you need to focus on in order to achieve a really synthesized, beautiful, natural result. The other thing that I think is really important is kind of a combination of innate skill, artistry, and understanding the mechanics. So, you can, like, for example, with a musician, you can take a musician, somebody who wants to play music, who just doesn't have a very natural ear for it, and they can take a lot of lessons and get pretty decent on the guitar or whatever, but they're never going to be truly great because you have to have some of that innate ability. I think with plastic surgery, there is kind of the same thing. You have to have an artistic eye. You can go to medical school, learn how to do surgery, learn the measurements and the numbers and the this and the that, but if you can't visualize exactly what something should look look like, and also not just be able to visualize it, but understand what techniques and skills and mechanical adjustments it needs to take the body or the form from point A to point B, you're never going to achieve that level. So I've seen surgeons who do, consistently good work, but it's never excellent because I just don't think they maybe have the true artistry. And then there's some artists that maybe that don't pay enough attention to the safety and the mechanics of surgery either. So I think it's that combination of the science, the art, the attention to details, sort of that innate eye of seeing what is really beautiful and being able to also be a good communicator too, because it's not just about making a patient look the way you think they should look. You have to understand what they want to and be able to translate that into the surgical result as well. It takes a lot of that and a lot of experience to truly achieve that level of excellence that's really important for getting the best results for patients.
On that note, thank you very much, Dr. Robert Cohen.
Thank you. It was a real pleasure speaking with you.
Thank you for being on the FACE podcast.
You're very welcome.